In the Crossfire tonight, we've got Democratic Representative Raul Grijalva and Republican Representative Steve Scalise. Welcome back. I'm going to start with you. I know you support this awful Upton bill. We got a lot of stuff to argue about. But before we get into that, the president didn't just say the thing that he's getting picked on for saying. He also said, I feel deeply responsible. He said, it's on me. He said, I've got to work to win back credibility. He says, I'm not a perfect president. He says, I'm going to get it fixed. This is the kind of leadership you've been wanting. You said you wanted him to be accountable, be responsible. Aren't you proud of the president today?
Well, what I want the president to do is to admit that this law doesn't work and to actually work with Republicans. I mean, look, Van, if you want to get good policy, you've got to work with Republicans and Democrats to get something done. He didn't want to do that when he passed the law the first time. He shut Republicans out. The law's not working now. He's acknowledging it. He's just not admitting that it's unworkable. He can't wave a magic wand.
Congressman, the law is working right now. Well, okay, how about this? For all the young people who are on their parents' plans, for the women who can't be discriminated against, you've got all the good stuff you guys rush past, and you go to the things that are not working. Are you against women benefiting from this law right now? Your party's got trouble with women. Are you against the women not being discriminated against right now?
I'm against all the women who are having their good health care plans canceled today. I've gotten so many emails and calls from constituents in my district that have had plans canceled. Look at Forbes magazine, just came out with a report today that for every one person who's gotten a policy under the president's health care law, 50 people lost the plans they like. Is that a good deal? Do you think 50 people losing their plan is good for one?
And the president came out to try to fix that. I know you're going to work with him to help him fix it.
Let me ask you about this, Congressman Grijalva. The president today, and this is just a practical matter, the president today said that implementation of his new proposal would rely on the insurance commissioners of the states working with the insurance companies. Literally by the time he finished talking, within less than 2 hours, the Washington State Insurance Commissioner, who's a Democrat, came out and said flatly, this will not work, we will not implement it. The National Association of Bipartisan, these are not the insurance companies that Democrats like to attack, these are the insurance commissioners, on a bipartisan basis, they said, it is unclear how, as a practical matter, the changes proposed today by the president can be put into effect. In many states, cancellation notices have already gone out to policyholders, and rates and plans have already been approved for 2014. Changing the rules through administrative action at this late date creates uncertainty and may not address the underlying issues. Aren't you concerned, not about ideology and all this stuff, but just as a practical matter, that the very people the president's calling on to do this within hours have already come out and said, this will not work and we can't do it?
Yeah, the concern, and thank you, the concern is for the private insurances. Private insurances have resisted the Affordable Care Act from the get-go, and there is a risk involved in the president's proposal. I think the president's proposal is an effort to try to continue to move this Affordable Care Act along and to allow people to have options. But if you're asking me what the risk is, the sole reliance on the private insurance companies that have canceled people at this point, to allow them to go back on, to allow them then to look at options, and to keep that moratorium for a year is a risk, and I agree with you. I don't know if it's so much the commissioners involved in that decision making as it's going to be that carrier and that private insurance company.
But aren't you glad that the president did step forward with some constructive solutions?
Absolutely. The hit on the president has been that he's sitting back and watching this whole thing unravel. What the president did today, I think, took a lot of guts.
I think so. And
you owe up to something, and you propose a fix.
And speaking of fixes, I mean, the president has put forward a fix that will let people who are getting these cancellation notices have a better chance. You're supporting, aren't you a co-sponsor of this terrible Upton proposal that it supposedly is going to keep people on their plans? But you look at it, explain to me how you can support this. You look at this proposal that you're a co-sponsor of, it doesn't require these insurance companies to keep them on the plan. It lets insurance companies forever keep dumping people, denying people, duping people. It doesn't fix any of the problems. How can you support a terrible law like this and then say Obama's wrong for trying to do something good?
Well, first, Van, it doesn't do the things you described. I'm a co-sponsor because what it does is it gives a little bit of power back to people. And it says if you like the plan you have, you can keep it. And it's not just you. If somebody else has has the same ability to go and get that plan. One thing you're failing to mention, and Newt talked about the National Association of Insurance Commissioners, they went further to say that this move by the president today would actually increase costs even more. And it's not just the cancellations. Millions of people are losing their good plans, and that's part of the president's broken promise. Another broken promise by the president was that his law would lower costs. We're seeing people now have higher costs, dramatically higher costs for health care.
Some higher and some lower. But your plan allows, it does not require these insurance companies keep those plans. It allows it. But what it really does is it's a back door. It opens the door back up in our system for these awful plans that dump people, deny people. Does it allow or does it require?
Well, first of all, it's not a mandate because the mandates have raised the cost. In fact, the mandates are what led to millions of people losing their plan. This came out in our hearing with Secretary Sebelius a week and a half ago. This is one of the things that people are just fed up with Washington about, is the president's health care law says even if you have a plan you like, we don't think it's good enough for you. Some unelected Washington bureaucrat can say, I think you have a lousy plan, even though you like it. So the real promise should have been, if Barack Obama likes the plan, you can actually keep it.
The point my colleague is making is muddled. Muddled because we've got to 43 plus efforts at the House level to defund. 43 separate votes to defund Obamacare. 17 days of a shutdown to defund and get rid of Obamacare. And looking at default right in the eye as a consequence of, again, getting rid of the Affordable Care Act. You know, I understand we want to help. The Upton bill does nothing but perpetuate a system that the Affordable Care Act is trying to take care of, treating women with equity, you can't be denied for pre-existing conditions. You can't put a cap on how much you can take care of people. I think those are all fine, necessary steps to get health care, and the 33 million uninsured that suddenly have an opportunity in this country to get health care.
But let me ask you this. I think look, the slogans, the values are fabulous. There's a practical thing. You have a president who has so mismanaged the internet access to this thing. You know, they had, from the time they signed the bill through this month, they've had more time to get a website fixed than the entire Second World War for the United States, and they couldn't get it to work. Apparently, the IT people came to the president and said, or the president's staff had said, this isn't going to work, period. Now, the question I'd ask you is, today you have the insurance commissioners who are bipartisan and the insurance companies saying this new thing isn't going to work. There's a practical thing here. Great values, great ideas, terrific promises. This isn't, people who are in charge of making it work are saying it isn't going to work. Doesn't it worry you that on top of the IT disaster, you could be about to have an Obama insurance disaster in January of comparable scale?
No, I think the IT disaster, let's use your word, Newt, is fixable. The effort to get that done is ongoing. We have 900,000 people that have registered on and are waiting to see what options they're going to have. That should have been expedited. It was unfortunate. I'm not defending the program and I'm not defending the computer. What I'm defending is the substance of this legislation that was passed.
Well, I'm with you defending that, and also with you in defending the president. Look, I watched the same news conference that you guys did, and you guys must be in the twilight zone. Here on planet Earth, I'm going to tell you why people who saw that press conference should be very proud of our president today. Welcome back. In the Crossfire tonight, we've got Representatives Raul Grijalva and Steve Scalise. I thought President Obama was great today. He basically said, look, I screwed up and I'm trying to fix it. Now, listen, the president has taken full responsibility, personal responsibility. He's given a mea culpa. That's all you can ask for in this situation. I think both parties should applaud him and try to work with him. Often you got politicians, they get in trouble, they stay in this defensive crouch when something goes wrong. That does not solve anything. This president stood up today. I was proud of him when he said this.
Am I going to have to do some work to rebuild confidence around some of our initiatives? Yeah. But part of this job is the things that go right, you guys aren't going to write about. The things that go wrong get prominent attention. That's how it's always been. That's not unique to me as president. And and I'm up to the challenge.
I just have to ask one thing.
Yeah.
When you have a national website go down
Sure.
for 45 days, you don't have to write about it. I mean, the president's characterization misunderstands the scale of this disaster.
Well, first of all, and I think it's very important to point out, a lot of his supporters say they just beat up on Obama because he's Obama. He was speaking to his base. He said, listen, every president gets a tough time when they make a mistake. And he was standing up and he was taking responsibility. I think there may be, and I go back to you, I think there may just be a philosophical difference here. Do you think that consumer protection is a value? That the government can have a policy of consumer protection? You guys keep talking about government takeover and government mandate and socialism and all that sort of stuff. From our point of view, this is basic consumer protection. Do you think that the government's wrong when it says you got to have seatbelts and insurance for your car? That's consumer protection. Are you against that philosophically?
I'm all for consumer protection, but
And
I'm
why is
also
this different?
But I'm also for empowering consumers. And the problem with the president's health care law is it takes control away from the patients and the doctors, and it moves it over to government. And if you look, the president talked a lot about responsibility. What he didn't talk about is accountability. Not one person's lost their job for over $500 million blown on this thing. It's not just the website, though, Van. This is the broken promises all the way down the line. President Obama has a crisis of credibility because so many things. People that are losing their plans, people that are seeing much higher costs for health care, all the things he promised that sounded great platitudes, they're literally taking dreams away from people who had good plans that are losing them, who had good jobs. People are losing their jobs because of this law.
Let me ask you, Roland. I want to stipulate, my good friend here is very idealistic. I think what you said earlier were great ideals. But at a practical because the president's got a practical job. Things are supposed to work. Wouldn't it have made sense for him to have brought the insurance commissioners in, not the companies, but the insurance commissioners in, had a meeting and said, will this plan work? I mean, it almost strikes me that his speechwriters and his political guys got together and said, we got to do something before the vote in Upton, or we're going to lose 100 Democrats. So let's do something. They came up with this thing. They apparently did not check with any insurance commissioners. And now they're being repudiated by the people who have to implement it. I mean, isn't there a practical part of this?
There's a practical part to it, but I think that the president's initiative, his response that I'm accountable and I need to fix that. And I, honestly, it's not idealism. You expect leadership from a leader. And so this initiative, whether a meeting occurred or didn't occur with the commissioners, in my point of view, is that he needed to show leadership, that I understand that this is a problem in effectuating and implementing the whole plan. This is my initiative. This is how I want to deal with it. And I thought it was necessary and appropriate, and it was a good thing.
But let me follow up for a second, because what struck me today was this amazing contrast in what the president said. We have two quotes from the president. One is from a month ago, just before the website went up, and the other was today. And I think if you listen to these, it raises a very troubling question about the White House. Not about the president, but about the White House.
Just visit healthcare.gov, and there you can compare insurance plans side by side, the same way you'd shop for a plane ticket on Kayak or a TV on Amazon. I don't think I'm stupid enough to go around saying this is going to be like shopping on Amazon or Travelocity a week before the website opens if I thought that it wasn't going to work.
Now, here's my very practical question again. The President of the United States has the biggest single thing in his domestic policy facing him, and apparently nobody on his senior staff told him what we now know from congressional testimony, the information technology people were saying, which is this is a really high-risk thing. When you look at Iran, when you look at Syria, when you look at other problems, doesn't it worry you that the president seems to be surrounded by people who can not brief him, not inform him, and nobody's fired, nothing changes. So the same people who didn't inform him in October are still sitting there. Doesn't that worry you?
No, it doesn't worry me, and I'll tell you why. Because I think that in other situations and other presidents, and I include Clinton and Bush, they had an advantage. And the advantage was that there was a cooperative atmosphere with the United States Congress, and particularly the House of Representatives. My experience has been that whether it's health care or any other initiative, the effort is to undercut and sabotage. It is not to try to find some middle ground. That is historic. even from the beginning of this whole discussion on healthcare. And so for me, the White House being the principal advisor for him, I think is necessary, and that's the team you put around you. But it's also the counterbalance is not there because the House is not going to sit with this president and try to work out a middle ground.
Isn't that true? I mean, you're sitting here pretending like you just want to be Obama's best friend. You're trying to fix Obamacare. You love it so much. You hate Obamacare. You're trying to repeal it. Isn't that right?
The things I don't like about it are what American families are seeing it do to their health care. This law was unworkable from the beginning. Back in 2010, there was a federal report came out that Barack Obama saw that said over 60% of people would lose their health care plans. And yet he still went around the country saying if you like what you have, you can keep it. That's the crisis of credibility. We've offered time and time again to work with the president on real solutions. Look, going back to when the law was passed, they deliberately shut out Republicans from the process. Didn't take one amendment. We had good ideas. They didn't want any of them. And this is what you end up getting. It's bad policy.
First of all, one good Republican idea was Romneycare, which Obamacare is. And so part of the thing is that, and you were there, I was there, we were all there. There was a serious attempt to engage. In fact, it took longer to get Obamacare passed than it should have because we were waiting, trying to figure out who's going to dance with us on the Republican side. You guys had a meeting before when Obama got inaugurated, saying you were going to oppose him on everything. And I just think it's very hypocritical for you guys to come out here and pretend
and I'll give you a specific example.
Give me an example. I want you to tell the true history.
During the time that the president's health care law was going through Congress, moving through Congress, Nancy Pelosi was Speaker, the president said on the campaign trail multiple times, if any Republican has an idea that they want to put on the table, I'll meet with any of them. Myself and 6 other members of Congress, including medical doctors in Congress, the next day said, we want to come meet with you. Not one time did we get an appointment with the president. Not one time. And I tried multiple times. We called the White House and said, we've got a lot of good ideas that'll actually help solve problems, lower health care costs. Not one time would the president meet with us, but he kept sitting on the campaign trail.
You know, the funny thing about history is that it's not necessarily repeats itself. It's there and it's fact. As we were going through the whole process of that vote for health care, it was the fact that accommodations were made to the private insurance companies. It's reflected in the legislation as it sits. And we gave up a public option. We gave up lowering Medicare age groups because we wanted to make it work. Those were concessions.
You tried.
This is going to be great. We're going to have you guys back and continue this. But for right now, stay here. Next, we ceasefire. Is there anything our 2 guests can agree on? We also want you at home to weigh in on today's fireback question. Do you think the president's fix for Obamacare will work? Tweet yes or no using hashtag Crossfire. We'll have the results after the break. We're back with Congressman Raul Grijalva and Steve Scalise. Now, let's call a ceasefire. We've been chatting during the break, as always. One of the more interesting things we should tape sometime. But let me turn first, Raul, to you. Is there something you think you and Steve could find a common ground on?
I think we can. You know, the Affordable Care Act was passed, validated by the Supreme Court, and there are premises. And I think what the president did today was to deal with a fix in a very strong way of an issue that's come up with the Health Care Act, which politically is creating a lot of backlash. And I think that's important. I think he's right. But there are premises to that. Benefits entitled to people now that weren't there before, pre-existing conditions, young people, women, equity, those things, if they are core principles, I think there's a lot of other middle ground.
You know, one thing, I think the president would be able to rebuild some of his trust if he acknowledged, number one, he realizes the law is not workable right now. You know, maybe long-term he and I would disagree on what we think happens years from now. But at the minimum, shouldn't we be able to at least agree that while this law is not working, we should suspend the penalties that American families would be hit with, because right now they can't go to the website and buy a product that the law says they have to buy, otherwise they'll be penalized. Suspend that penalty because you can't even go and comply with the law.
Would you agree with that, that if by January 1 they haven't gotten it all fixed, that we should find some way to not penalize people?
Not necessarily, because I think that one of the efforts, and I'm not implying anything here, but one of the efforts is to undermine the mandate. And you undermine a mandate, we're in trouble.
Okay. Let me say thank you to Representative Raul Grijalva and Steve Scalise.
And you can go to Facebook or Twitter to weigh in on our fireback question. Do you think the president's fix for Obamacare will work? Right now, 30% say yes, but 70% say no. So the debate's going to continue online at cnn.com/crossfire, as well as on Facebook and Twitter. From the left, I'm Van Jones.
From the right, I'm Newt Gingrich. Join us tomorrow for another edition of Crossfire. Aaron Burnett out front starts right now.